question about breast cancer is a huge one, and I certainly won't try to go into all the details now, but let me start with about 20 years ago. There was a very, very large randomized controlled trial of a specific kind of hormone therapy, and when that trial, which was called the Women's Health Initiative, had been running for about 5 years, there was a decision made to stop it. And there were two reasons. One is that they did not see an improvement in cardiovascular risk, and the other is they saw a very small increase in the risk of breast cancer. The problem is that was across every single participant in the trial. And what we now understand is that women who are younger and women who don't have specific risk factors for breast cancer have a probably not zero, but very, very small increase in risk. To give you, the numbers are important here. To give you an idea, a woman who is age 50, and I'll use US statistics, they're not that different across the globe. A woman who is 50, if you look at a group of 1,000 women who are 50 years old, about 4 of them will be diagnosed with breast cancer in the next 12 months. So that's 4 out of 1,000, or 0.4%. 4 women in the women's health trial who were on both estrogen and progestin hormones, their risk of breast cancer was about 5 per 1,000 women per year. So it was 1 additional person per 1,000 people per year. So starting out, that's a pretty small difference. The other thing is to understand that the hormones that were used in that trial are not the hormones we're using now, and we have some data to suggest that the hormones we're using now have a lower risk of breast cancer. The other really important thing is, in the Women's Health Initiative, that was across women between the ages of 50 and 70. And we know that the prime target for the benefits of hormone therapy and the prime target for safety of hormone therapy is between the ages of 45 and 60. And so, it's not a simple question, but the bottom line is that the risk of breast cancer is important to consider, but it should not scare women away wholesale from the idea of using hormone therapy. The background to that question is that, unfortunately, we all gain weight as we get older, regardless of our biological sex and regardless of whether we take HRT or not. HRT on average does not increase the weight gain that is typically seen. What does happen, and this is really, I think, where the concern arises, is when you go through menopause, the loss of estrogen and progestin hormones tends to make fat accumulation occur more around your belly and less around your thighs and buttocks. With hormone therapy, it tends to mitigate that. So in fact, hormone therapy helps to distribute the fat more broadly and less in your belly. The other thing is that the loss of estrogen increases your risk of developing diabetes. And this is, of course, a very common problem both in the United States and in India. And so that's a very important benefit of hormone therapy, is that it actually helps your body properly metabolize sugars in a way that can reduce your risk of developing diabetes. So for both of those reasons, women shouldn't be worried about increasing the unfortunately normal tendency to gain weight because they're taking hormone. I think that is not waiting until you have very severe, very disruptive symptoms, or feeling like you don't deserve to have your perimenopause and menopause struggles addressed, is the wrong approach. So as a generally some significant subset of women have their most severe symptoms in the perimenopause, particularly in late perimenopause, so that it is not at all the case that it's proper or medically correct to wait until you've stopped having bleeding. If you are having symptoms that are disrupting your life, and if you have either tried some health and lifestyle changes and those have not made it so that you are not being held back by the symptoms that you're struggling with, then you should consider hormone therapy. It does not have to be severe. The bar is perhaps better to think of as, if this is something that's disrupting your life and decreasing your quality of life, and simple interventions have not been able to address the problems, then you should consider yourself someone who is a candidate for hormone therapy. The other thing to keep in mind is that, particularly with respect to bone health, the bone loss that is so dangerous for women when they get in their 60s and 70s and 80s starts in perimenopause. It's kind of bad news. When perimenopause starts in your mid-40s, you're already beginning to lose bone mass at a faster rate than you were before. And so one of the things that early intervention can do is help to mitigate that loss of bone. And so there are reasons why it's very reasonable to think about starting hormone therapy earlier rather than